Gauteng Premier David Makhura is calling on the National Coronavirus Command Council to provide additional support to the province. He says since the country moved to lockdown level 3, cases have been increasing. Gauteng now has the second highest number of cases after the Western Cape. Let's speak to the Health MEC in the province, Dr. Bandile Masuku. Dr. Masuku, good evening and thank you so much for your time on News at Prime. Firstly, what is the rate of infection with which Gauteng is currently multiplying?
Yes, I think good evening. I think the levels, since the levels have changed to level 3 of the lockdown, we have seen quite an increase in the number of infections that we are seeing, and it has been something that we are quite concerned about, particularly as it relates to the competing needs in terms of the ICU resources that might also come across in terms of the ICU and trauma.
So, on average, how much is one person that tests positive for COVID-19? How many other people are they potentially infecting with the virus?
We were working around the infection rate of around 3 on the basis that our modeling have been actually modeled around 3. We call it an infective rate of 3, and it's something that we are actually looking at. But the issue here is that our initial modeling was working on the assumption of 1:5, but now we have actually reduced it to 1:3 because of what we have seen in the past 2 weeks because of the lockdown.
So what are the patterns that you're seeing when you look at how COVID-19 has been spreading, and perhaps comparatively to what we've seen in the Western Cape and the Eastern Cape? Would you say that Gauteng is following the same trend with the community infections or the infections that are taking place in a particular workplace, a particular shopping center, etc.?
Yes, it's a similar pattern that we've recognized, that we have seen in Western Cape. And in particular, the issue of funerals are a big problem for us, and also shopping centers are a big issue for us. So it's one of these outbreaks that we have to go and actually contain. You have realized that in the past 2 weeks we had a big problem of the mining area in Morafong, which we had to deal with because of the increased number of these social gatherings that were increasing in that area.
Sure. When you look at then just the regions in Gauteng, are there particular regions that are more concerning than others?
Yes, I think Sidibeng is not of a big concern to us because of the low rate of the death and the number of confirmed cases around Sidibeng. But of concern now, we are actually looking at sub-districts. There are sub-districts that have got more than 20 active cases. In particular, you find those sub-districts in Johannesburg, and these are associated with malls, shopping centers, and also a lot of informal trading that is actually happening in those areas. So we are now focused more on sub-districts beyond actually the districts, and Johannesburg is our main concern at the moment.
So what then becomes your response? Johannesburg quite busy but also highly populated. How do you intend making sure that you're able to infiltrate all the walls that you need to get through?
We've done almost successfully, even with the mining sector, where we entered. We did a whole lot of screening and also removing those who are active cases from the community to be isolated in our quarantine sites. So we are going to apply almost the same intensity in terms of screening and testing in those areas, and also just to make sure that those who are affected and who cannot self-isolate, we actually remove them from the community so that we interrupt the actual transmission spread in that regard.
Some of your projections show that Gauteng may reach its peak sometime in July. What are the numbers that you're looking at when it comes to the peak in this province? And when you're asking for assistance, how much of that assistance is based on the modeling too for what you anticipate?
The major issue for us is just to make sure that the system is ready enough to be able to sustain and be able to absorb the pressure. Because I've seen that we have made an unfortunate definition of the peak when it's defined, when the system is actually crashing and it's actually crumbling. But we want to get into a space where our system in Gauteng is able to absorb the pressure and is able to absorb the numbers. And hence we want extra assistance from actually national and also looking at our neighboring provinces, particularly the hospitals or facilities that are close by in our borders from other provinces, which don't really have the numbers that they have that are similar to us.
Yes, but what assistance are you looking for?
No, we are looking for the assistance that relates to particularly the issue of field hospitals. We are looking at expanding our Newzroom field hospital, but also trying to put up other field hospitals in Tshwane area, in Eguruleni area, particularly around Davidton area, and also putting one around Deep Slot area. So this is what we are looking at in terms of the infrastructure, and we have a plan that we have actually put across, which also the SNDF has actually shown interest in assisting us in terms of human resource demands and also putting up the facilities themselves.
Gauteng, of course, has the unique problem of being the urban center, if I can call it that, of the country with an incredibly high population. So when you look at the peak rate, how many people are you expecting could potentially be infected by COVID-19 when we do reach that peak?
In terms of our modeling, we are looking at a situation where we're going to get around 1.8 to 2.5 million people who will be infected. And this is what we are looking at as a worst case actually scenario. But what we are putting across is that we know that 5% of that will actually require us to be able to hospitalize them. But we know that that number, we can be able to sustain ourselves and the system can be able to absorb them through.